Good afternoon, everyone. Welcome, welcome, welcome. Happy Wednesday, I think today is. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to part 2 of Making the Healthcare System Work Better for You, Session 4, Where and How to Get Your Healthcare. So in previous sessions, we've talked about being an empowered healthcare consumer and building and cultivating your healthcare provider and team. So hopefully through those 2 sessions or a few sessions we've had so far, that you've been able to gain a deeper knowledge about really how to be more proactive and take ownership of your health and healthcare and what being an empowered healthcare consumer is really all about. So in today's session, we're going to talk about and learn about prevention strategies and how to manage your health throughout different stages of your life and when and where to get your healthcare based on what you're dealing with and what you need. And also know how to exercise your rights. If you all participated in the series last year, you know that the first session we talked about was know your patient rights. And so we're going to talk a little bit more about how you actually can exercise those rights and engage in more effective communication with your primary care provider as well as your healthcare team, so that you can make your healthcare team as well as the healthcare system work better for you. And, this is more important now probably than ever before, especially now with all of the changes that are resulting and will change over the course of the next 6 months to a year or so, that will really reshape how Medicaid and possibly Medicare and other healthcare programs will work here in the US. And so again, now more than ever, we all will need to know how to stay informed about all these changes, how they will impact us as individuals, as well as our families and the people we love and care about, how to actively manage your healthcare coverage and make sure that you're able to keep your coverage, or at least how that may change going forward. And definitely understand how to advocate for yourself and your family and make sure that you get information from trusted and valid evidence-based resources to help you make decisions and navigate through this even more ever-changing complex healthcare system. So once again, we are fortunate to have Dr. Melissa Clarke with us today, who is the co-author of Excuse Me, Doctor, I Have What? The book was created to help healthcare consumers really understand how to communicate, navigate, and advocate for themselves when they're interacting with the healthcare system. So before we get started today, I'd like to cover just a few housekeeping items. So we will hear from Dr. Clarke, and as per usual, we'll have a Q&A session after she completes her presentation. If you have any questions along the way, please put them in the Q&A box. But if you want to give a shout out, make any comments, say hello to people as we're progressing through the webinar, please feel free to do that in the chat box. Everyone will stay off camera and muted throughout the duration of the webinar. And yeah, again, if you have any questions, don't forget to put them in the Q&A box. And so before we get started, I just want to, for those of you who still may not be familiar with the California Black Health Network, I'd like to just say a little bit more about who we are and what we do. We are the voice and trusted resource for Black health equity in California. At least for now, we can still use those words. And we are the only Black-led statewide organization in California that is dedicated to advancing health equity for all African Americans and Black immigrants. We conduct outreach, education, advocacy, and policy work, as well as programmatic work to help achieve health equity. And we do this through the lens of understanding the critical issues that lie at the intersection of racial justice, social justice, and environmental justice. And our vision really is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we work to do that every day through our mission to ensure that all Black Californians, really, regardless of how well educated they are, how much money they make, where they live, how they self-identify, who they love, whatever their housing or immigration status is, that they have access to high quality and equitable primary care and definitely, sorry about that, avoid succumbing to diseases and definitely those that are preventable. And so hopefully some of the tools and information that we've been sharing with you through this series can help you really be more proactive about your health and well-being and focus more on prevention, which is going to be part of the topic that we cover today with Dr. Clarke. And so we'll just give you a little more information about Dr. Clarke. Just bear with me for a second here. And so Dr. Clarke, as I mentioned, she's an author. She's a TEDx keynote speaker. She hosts the health show. She's a thought leader, physician, educator. And hold on, can you all see the slide with Dr. Clarke on it?
Yes.
Okay, great. She is a Harvard-educated emergency medicine physician with over 30 years of healthcare experience. Dr. Clarke has been on the front lines of addressing health disparities and health literacy and improving the way that doctors and patients work together, really building that partnership and more effective communications. Dr. Clarke is the medical contributor to the Russ Parr Morning Show and has made numerous television and radio appearances, including on CNN and other television shows. Her book, Excuse Me, Doctor, I've Got What, is a roadmap for how to be a smart healthcare consumer and understanding why now taking control of your health and healthcare is more important than ever before. So based on her book, Dr. Clarke is the host and co-creator of Excuse Me, Doctor with Dr. Mel, a live weekly health forum on Sirius XM and streamed on YouTube and Facebook, where she provides urgent information and answers audiences' questions about whatever it is they need to know in real time. So that is every Monday night at 6 p.m. Pacific, 9 p.m. Eastern time. I can say a lot about Dr. Clarke, but I think she has a lot of information that's important for us to hear today. So without further ado, I'll turn it over to Dr. Clarke, and she'll walk us through her presentation for today.
Great. Well, thank you so much for that wonderful introduction, Rhonda. I always count myself fortunate to be able to be here with you, and I'm grateful for the invitation from California Black Health Network to be a part of this amazing series. And you all, as the amazing audience that participates, I have subtitled this session. It's really about getting your care, right? But I have subtitled it Health Boss Moves, right? Stay ready so you don't have to get ready. It's all about being proactive and making those moves that really position you to be as in charge of your healthcare as possible and work in effective ways with your healthcare providers. So, what we're going to cover today is the first is about the schedule of preventive visits and vaccinations that are recommended. I've broken it down by age group, and it's mainly for it's actually adults 18 and over. It would take a whole nother session to do children, which we might come back and do at a later date. But for today, it's 18 and above. And then gaining tips for building open and clear communication with your healthcare team. That's so important to remain engaged, to be proactive. And, even though really the bulk of the communication expertise should be on the side of providers, oftentimes we don't see that. So what role can you as the consumer play in ensuring that you have open and clear lines of communication? And then finally, we're going to wrap up with talking about where to get care, right? When is it appropriate to go to the emergency department versus your primary care? And also a section that straight out of my book that I call Surviving a Hospital Stay.
Yeah,
So
Dr. Clarke, I'm sorry for interrupting. I think there's a window that's open on your Canva window. Yeah, there we go. Thank you.
Okay, let me reshare that. Okay. Is it, are you able to see now?
Yes, now. Yes. Thank you.
Thank you. All right. I think a picture is worth 1,000 words, right?
Yeah,
And
I'm
as you,
sorry. It keeps popping up. I'm not sure why.
I don't know why. Let me see if I just
So if
minimize.
you can close it out, maybe instead of minimizing it,
Well, when I closed it out, it caused me to
it's
have
still,
to reshare. So that's why I minimized it. But can you see now?
Yeah, this
yes.
looks fine.
Yeah, sorry
Okay.
for the interruption. Yeah.
Yeah, no worries. Thanks. So, as I mentioned, a picture is worth 1,000 words. And when it comes to really being proactive about maintaining this gift that we have of a human body, I think, sometimes I see people put more effort into maintaining their cars than they do their bodies, which we have to be proactive throughout our lives and making sure that we maximize our health as we go along. Because otherwise, we might end up more like the car on the right than the car on the left. And so, this next set of slides is really all about how can we be proactive when it comes to preventive maintenance of our temples, right? So, um, there we talked about the 5 self-health actions in the first um, webinar, in our first session. So, in addition to doing our 5 self-health actions, the things that we do and we have control over, our sleep, our nutrition, our hydration, our movement or slash exercise, and the way we manage stress in our lives, this next set is how do we partner with our health providers, our healthcare providers, to be proactive? Because we know that preventive screenings and vaccines save lives, right? We also know that if you do develop a chronic disease, whether that be cancer or heart disease, detecting it earlier leads to improved long-term health outcomes that you see up in the top right-hand corner. And it also means for your pocketbook, less out-of-pocket costs in the long run. It could be less medications, less visits to the emergency department, fewer hospitalizations, all of which, even if you have insurance, end up costing you. So it's important to really think about maintaining your health because it improves your quality of life. It includes your ability to enjoy life, and it also means better health as well as a better financial picture in the long run. And then as we think about partnering with our provider to get those preventive screenings, vaccines, part of what we have to think about is what age are we at? What's our gender? What's our family history? What are our risk factors? So um, the preventive maintenance is really tailored based upon these things. Do you have a family history? Not all of us can know our family history, but it's good to talk with our mother, our father, our grandparents, aunties and uncles to understand what are the diseases that run in our family. It could be that there's a lot of prostate cancer, breast cancer, and pancreatic cancer. That might mean that you need a whole different set of screenings than somebody who doesn't have that family history. Maybe you have a history of people having heart attacks under the age of 55. Again, that implies a whole nother set of screenings if you have family history. The other is what does your lifestyle look like? What is your degree of sexual activity? Do you smoke? How often? Do you drink alcohol? Or how often? Again, all these things um, will help point in the direction of what kinds of screenings and how often you need. The same for occupational and environmental exposures. So if are you in a industry where you are exposed to asbestos, or have you lived in an environment where there's been lead paint? Again, these things are important to know, and your doctor should be asking you about these so that they can decide what kind of testing you need and how often. And then finally, we know about differences in health outcomes, health disparities between different ages, different genders, and especially different races and ethnicity. So as I go through, I'm going to be pointing out those types of screenings that we as African Americans should be starting at earlier ages, because statistically we get diseases, if we're going to get them, 10 years earlier oftentimes than the white population. So I'll be pointing those things out as I go through. And also, please feel free to put your questions in the chat as we go along. I'm not going to be looking at the chat just because of the way my screens are set up. But if someone from CBHN can just interrupt me when there are questions, happy to answer as I go through. So let's talk first, before we get into the schedule, about why are vaccines part of preventive care? Well, you probably know that vaccines are really crucial in helping to teach our immune system um, the germs that we need to be protected against, right? So by exposing our body to these germs, specific viruses, specific bacteria, it allows our immune system to be on the ready, so that when we do encounter them in real life, we already have the antibodies, we already have the soldiers lined up, ready to attack any of these particular uh, viruses or bacteria that we're exposed to. And it's important to have that lead time, because especially if our immune systems are not, um, you know, uh, at their best, right? Um, then some of these viruses and bacteria could actually overwhelm our body. So it's important to have our troops, so to speak, our antibodies at the ready, so that we avoid getting extremely sick. We saw this in COVID during the height of the epidemic. The pandemic, the reason why vaccines were important were so that we had antibodies at the ready should we be exposed to COVID, and that cut down on severe illness, hospitalization, and death. It takes a couple of weeks, 2 to 4 weeks, for full protection to develop, but depending on the vaccine, that protection can last a lifetime. Some vaccines, though, require boosters, and they require boosters at different periods of time. So for flu and COVID, for example, we need a booster every year. For a tetanus booster, that's only every 5 to 10 years. So it depends on the vaccine, and your healthcare provider knows that schedule, but just know that there are going to be some vaccines that you need yearly, some a booster every 5 to 10 years, some a booster beyond that. And it's important to know that all vaccines are tested to ensure that they can be given safely and effectively at the recommended age. And there is a database that monitors um, uh, what happens in the public, that anyone can enter a side effect, and the public health service looks at that to see, are there certain spikes above normal with certain things happening, so that they can closely monitor if there are any adverse effects. And another sort of case example of why vaccines are important, measles. In 2019, the United States had over 1,200 cases of measles. That's the largest outbreak since 1992. And that's actually only going up. We now not only have measles outbreaks, we're having measles deaths. Measles was almost eliminated in 2000 because of the high vaccination rates. But as fewer parents, spurred by misinformation and concerns about the vaccine, have been, uh, not getting their kids vaccinated, we're now seeing these outbreaks. We're now seeing children die of measles, which is an entirely preventable occurrence. The other uh, piece that's often cited when we talk about vaccines is polio. You know, the generation above me, those in their 60s, 70s, 80s, might remember when polio was a thing, right? People younger than me, they've never seen polio. So it's a very theoretical thing. But getting vaccinated against polio and the vaccine is what eliminated polio. So again, vaccines very important as part of prevention. So let's talk about what should be happening at every age. If you're a Gen Z or a millennial between the ages of 18 and 39, these are some of the things when you go to the doctor, you should be talking about, you should be having done. So every 2 years, and let me just also preface, this is for people who are healthy. If you develop any of these conditions like high cholesterol or diabetes, you're going to need to be monitored on a totally different schedule than what I'm talking about. So this is just checking if you're healthy to make sure you're still healthy. All right, so blood pressure every 2 years, if it's normal, normal is 120 over 80 in that neighborhood. But if you have risks, like if you're overweight, um, you should, or you have diabetes, you should get screened more often than every 2 years. High cholesterol. So you should be getting a blood test for cholesterol every 5 years, starting at age 20. And again, if you're at risk in any of those ways, diabetes, high blood pressure, overweight, or a family history of high cholesterol, you should be, or early heart disease, you should be getting screened more often than 5 years. Diabetes. If you're overweight, have high blood pressure, or family history, again, you should start screening age 18 to 39. But once you turn age 35, you should be getting routine screening every 3 years regardless. Okay? So 18 to 35, optional unless you have a risk factor, 35 and older, every 3 years regardless. Sexually transmitted infections, that's what STIs stand for. So your sexual health is part of your overall health. And so you should be getting screening every 3 to 6 months based upon whether you are engaged in having sex at that point in your life. So these are some of the ones that are screened for: HIV, gonorrhea, chlamydia, HPV, which stands for human papillomavirus. That's the virus that causes warts, genital warts, and it also causes cervical cancer. So we're going to touch on it again in the next slide. And then, of course, syphilis. So these are some of the ones that can be screened for every 3 to 6 months, um, depending on your sexual activity, whether you're in a committed relationship or not. Mental health, again, very important, should be screened for depression and anxiety, especially in our young people. Very important to be proactive in identifying it and setting up a treatment plan if identified. And then what are the immunizations? Flu and COVID-19. Tdap stands for tetanus and diphtheria. That's every 10 years. And then HPV vaccine, that starts in your preteen and teenage years. If you haven't gotten it by the time you're 18 to 39, that's the time to go ahead and finish it off if it wasn't done earlier. What are the gender specific ones? So for women, or anyone um, who was female at birth, should have a pap smear starting every 3 years, starting at age 21, or it could be every 5 years if at the time the pap smear is done, you also test for the human papillomavirus, HPV, which is what causes cervical cancer. And if you have had infection with HPV in the past, if you have a weakened immune system, for example, if you have HIV, if you smoke, if you had multiple sexual partners or a young age at first sexual activity, if you've been on contraceptives for a long time, if you have a family history of cervical cancer, or you're overweight, your doctor may advise testing more often than what's listed there. Breast cancer, also important to consider screening at age 30. So we know that the recommended age is really to start at 40, but there are going to be some instances, especially for African American women, um, who are at higher risk for getting aggressive breast cancer at an earlier age, to consider screening even earlier, especially if you have a family history, especially if you have a BRCA gene mutation. So that means that you have a gene that predisposes you to breast cancer. And if someone in your family has that, then you should be also tested for that BRCA gene. And if you have it, you should be getting mammograms starting at a younger age. If you've been exposed to radiation, if you have dense breasts, and if you're overweight, all those things can play into the decision about what age you start to get mammograms. For men, age-specific screenings include testicular screenings. Men in this age group, 18 to 39, are at higher risk for testicular cancer. That risk goes down as they get older. So this is definitely a 18 to 39 year old man should be, or male at birth, should be getting testicular screenings. All right, now we're ready to move into our next age group, 40 to 49. So, what should be happening? The top row are the same things that I already mentioned for age 18 to 39. So, I won't go over those again. However, at age 45, that's when you should be thinking about getting screened for colon cancer. Unfortunately, we've been seeing colon cancer happening at younger and younger ages. It used to be that you started getting screened for colon cancer at age 50. Now they've dropped it to age 45. We all know about Chadwick Boseman, who had colon cancer in his 40s. So, really, really key to get started with that screening at age 45, especially if you're African American. Again, one of those diseases that show up in the Black population at an earlier age. Blood pressure. We're now age 40 to 49. We want to move to getting it done yearly. And if we have risk factors, like I mentioned before, overweight, family history, you want to, or diabetes, you want to consider even every 6 months. And then same set of vaccines, minus the HPV that should have already been done by age 40 to 49. And then again, considerations for women that age group, um, same thing. If you did not already start at age 30, you should definitely start at age 40 with getting mammograms, and that's every 1 to 2 years. And now this is the age where men should start to consider getting prostate cancer screenings. So that's somewhere around age 40 to 45. If you are a Black man, because prostate cancer, again, shows up earlier in the Black community. If you have a close family history of prostate cancer, so that means father or uncle or brother with prostate cancer. If you've had many family members, regardless of their close family members or not, who've had early onset prostate cancer, so in their 40s or 50s. So that's if your grandfather, uncles, cousins had early onset prostate cancer, you should be getting screened age 40 to 45. And then finally, this is one that a lot of people don't know. If you have the BRCA mutation, a lot of people think of the BRCA mutation as only associated with breast cancer. It's also associated with prostate cancer. So, if there's a woman in your family and you're a man and the woman has a BRCA mutation who's a close relative of yours, you should get tested for the BRCA mutation as well. And if you have it, you should start screening for prostate cancer early on. All right, so we've now done 18 to 39, we've done 40 to 49. Now we are in our 50s. What should be happening? So, same thing, same as before for 40 to 49 with blood pressure, cholesterol, uh, colon cancer screening, diabetes, sexually transmitted infections, and immunization. Well, those five. So, and mental health. So the two new things here are lung cancer screening. If you are a smoker, or even if you've stopped within the last 15 years, right? You should be getting a CAT scan of your lungs every year to screen for lung cancer. So very key. Current smoker, or even if you've quit, but it's been within the last 15 years. And then with immunizations, you're now going to start thinking about adding shingles, the shingles vaccine. Um, that is to protect against that very painful rash that you might have seen some older people develop, especially when at times of stress. Um, if you get the shingles vaccine, it will severely, severely, severely cut down on your risk of ever having shingles. And then pneumonia is a vaccine that you get twice, 10 years apart, starting age 50 to 64. And oversight is COVID. COVID should also be up there for sure. And then what are the ones for women uh, specifically in this age group? So you're continuing your mammograms every 2 years. Um, the DEXA scan for osteoporosis at age 50, there are some Caucasian women are at higher risk for osteoporosis, but this is definitely something you should talk to your doctor about getting. It means weakening of the bones, and you can be at higher risk for fractures as you age. And so, what the DEXA scan tells you is how dense are your bones? Denser is better. It means they're stronger and less likely to break. And if you are diagnosed with osteoporosis, there are medications and exercises that you can do to help increase your bone density, and supplements that you can do to increase your bone density. Um, and then, of course, cervical cancer, that screening should continue until at least age 65. You can discuss the age to stop based on your lifestyle with your healthcare provider. And for men, you're continuing the prostate cancer screenings. Um, Now, we are now in our 60s, 65 and above. And again, blood pressure, cholesterol, colon cancer, STIs, diabetes, mental health, lung cancer, all unchanged. What's changed here is cognitive and mental health. In addition to screening for depression and anxiety, now is a good time to start doing yearly checks for memory. There are screens that your doctor can do with you just to make sure, or you can ask if you are concerned or if a family member is concerned about memory to get these screens done with your doctor to indicate should there be more advanced testing done. Um, Immunizations, again, remain unchanged. COVID should be there as well. Vision and hearing, great time to also now incorporate regular screenings for vision and hearing. And I think those are the main differences for age 65 and above. For women, your mammograms should continue until age 80. Um, Again, still getting the DEXA scans every 2 years. That's for the screening for osteoporosis. And men, PSA screening every 2 to 4 years up until age 70. So then, what are your next steps? You want to, again, always schedule your regular checkups with your doctor so that these schedule of vaccines and preventive screenings can be happening on a regular basis. Um, Prioritizing lifestyle changes. Remember, I talked about if you had been a smoker and you quit smoking, you no longer needed the CT scans after 15 years. That's because the body is amazing and can heal itself from the damage that smoking does to our body over a lifetime. It takes 15 years to be out of the window of risk for lung cancer. But those lifestyle changes are really important to give your body those 5 self-health actions I mentioned in the beginning, really key to give your body the optimal chance to heal from what we experience daily from exposure to viruses or to um, environmental hazards, or eating junk food or high levels of stress. Those 5 self-health actions really key to improve your long-term health. And then just be proactive about your preventive care. All right, so we know all about our preventive screenings and our vaccinations now. We have to go through our primary care uh, provider to be able to partner effectively to get these screenings and vaccines done. So, how do you go about partnering with your healthcare provider? Um, well, one is you have to find one, right? And I wanted to just mention, Rhonda kind of set this up by talking about the changes that are coming down the pike in the healthcare system and how some people may lose their Medicaid coverage because of stricter requirements to get on Medicaid. Or you may have a plan through the California healthcare marketplace under Obamacare, and you might have been getting subsidies that made it possible for you to afford that plan. Those subsidies are a high likelihood for going away, disappearing, and so the premiums are going to probably go up, uh, are going to go up for everyone who has a marketplace plan. So what do you do if you can't afford health insurance or you don't qualify for Medicaid anymore? Well, there are federally qualified health centers, or also known as community clinics, that are there specifically because they make care affordable, and they see people on a sliding scale. So you pay what you can, essentially, and you can get very high quality care at a federally qualified health center. They're funded by the federal government. They provide medical, dental, mental health, and preventive health services. Um, Everybody is welcome. But again, for those people with low income, with no insurance or limited insurance, it's a great option to get regular care and form a partnership with a primary care team. Um, they see people on a sliding scale. So if you don't have income, you won't pay anything. And then you can go to findahealthcenter.hrsa.gov. So findahealthcenter.hrsa.gov. Put your zip code in, and it'll tell you
So,
where is a health center, a federally qualified health center near you.
so excuse me, Dr. Clarke. I know some of us know, but I think maybe the average person doesn't know what HRSA is or how to spell the act when you say
Oh,
HRSA.
I'm sorry,
Yeah,
HRSA.
yeah.
Um, so that is the arm of the federal government under HHS that deals with health and human services. It's specifically the division that is responsible for health services. So HRSA.gov. Thanks for pointing that out. So you're getting a doctor. What do you want to look for? Well, it all depends on, what your priorities are. But what I've put up here are common complaints that I've heard over the years from patients about their doctors. And that if you had this checklist ahead of time so that you can interview them like you would anybody else who's going to be providing you service, to assess them for listening skills. Are they letting you tell your story? If they're interrupting you, are they apologizing ahead of time so that they can get the information that they need from you to help make assessments of your health? What's their attention span? When they close the door, are there people that are coming in and bothering them? Are they letting them know, look, I'm with a patient. Hey, I need to be able to focus on my patient. Um, do they listen with compassion? Do they empathize with what your concerns are? A lot of people like to have a broad healthcare team that includes non-traditional, non-Western medicine practices like Reiki or chiropractic or acupuncture. And so, are they open to other healing practices? For some people, that's very important. And I think it's if you do, you should let your practitioner know up front that that's very important to you. Do they talk to you, using simple language that you can understand so that when you leave the doctor's office, you're clear about what just happened, what's wrong with you, what you need to do next, and when you need to see them back? And shared decision making. That might not always be obvious in a preventive visit environment, but even in the preventive visit, the decision about what age, for example, to get breast cancer screening, these things are ultimately up to you. Your doctor should be explaining, or your provider should be explaining the pros and cons, but ultimately the decision is yours. You should understand clearly what are the pros and cons of any healthcare decision so that you ultimately make that decision. That's what shared decision making is. They're the expert, you're getting the advice from them, and you're making the decision. And then finally, knowledge of their limitations. If you ask them a question, you can kind of tell when people are making up an answer. So if they don't know, they should be clear in saying, I don't know, I'll get back to you on that. So this is my sort of checklist that I recommend people use when they talk to a provider for the first time. Sorry. And then this is what you should be expecting. We've talked a lot about patient rights, but this is sort of a concise summary of what you should be expecting from your care team. That they clearly explain your conditions and what your options are. That's the pros and cons that I just talked about for the shared decision making. Obviously, they should be treating your conditions, and you should be understanding the link between what the treatment plan is and what the condition is and how you should be expecting it to improve over time. They should be coordinating you or helping you coordinate your care plan. This is especially important for people that have chronic diseases that are complex, like diabetes, that can affect multiple areas of your body, and you might need to see multiple specialists, the eye doctor, the heart doctor, the neurologist. Your primary care doctor's role is all about helping to coordinate your care plan and the care that you're getting. Obviously, they should be providing follow-up care and then helping you to uh, for your needs, advocate for you based upon your needs and your values. You should feel like they're in your corner and they support you and understand your needs. And that's not going to happen on the first visit. That's over time developing a relationship, which is the benefit of having a primary care provider who you see on a regular basis. Communication in any relationship is key. So, what can you do to improve that communication with your provider? One is bring a list or bring the pill bottles of what you're actually taking, your actual medications. And, they may be able to see your list of medications at the pharmacy, but a lot of times people take supplements that their pharmacist doesn't know. So again, even if you're taking supplements, important to bring those to the visit. Um, some people have perfect recall, right? I'm not one of them. So if I have a problem, it's helpful for me to jot down some notes before I see my doctor so I can make sure that we cover everything that I want to make sure gets covered. And have the details as best as you can in terms of how long it's been going on, what you've tried, what worked, what didn't work. Know your past and present diagnosis. That's mainly important if you're seeing somebody for the first time. If you have a patient portal that you can give them access to so they can look up your medical history and see your prior records. And this is really key. I can't tell you how often I hear, somebody went to their doctor, they didn't like the outcome of what the doctor prescribed, so they just cut them off. It's really important for you and for the doctor to follow up and let them know that what they prescribed didn't work. Okay? Because that helps them with the next patient and it helps them with you. It helps them to treat you in the way that not everything works for everybody. So it's important as they develop a relationship with you and can understand what works for you and what doesn't, that makes the relationship better. So if you have a good relationship with your doctor or somebody you like and you want to continue to see them, but they prescribe something for you that doesn't quite do it, don't end the relationship because of that. Continue to engage, give them the feedback, give them the opportunity to make it right. And then again, this is something that you shouldn't have to do. But given the fact that our healthcare system is broken and fragmented, it's sometimes important to make sure that the doctors that are involved in your care are talking to each other. So provide a list of the other healthcare providers that you're already seeing to your primary care so they know. It's often important to give them written permission to communicate with each other and give them access again to your patient portal so that they can see what's happening with your care with other doctors. And you might be going to doctors in different healthcare systems that have different patient portals. Again, the more information that you can share between providers, the better. The less medical mistakes happen, the more your care can be coordinated so that you can have good outcomes. All right, so that's all about communication. Now, this is about um, when to access care. In this instance, it's in an emergency. So these are not an exhaustive list. Okay, I want to be clear. There might be something that I missed that you just feel I must go to the emergency department for. So I don't want you to refer to this list, and if it's not on there, don't go. But this is a good sort of guideline, some guidelines about when to go to the emergency department. If you have sudden or severe symptoms, right? Choking, chest pain that you've never had before, trouble breathing, severe abdominal pain or back pain. If all of a sudden your arm goes numb or weak, you lose consciousness, you get confused, your speech isn't coming out right, those are all potential signs. Those last few that I named are potential signs of stroke, all reasons to immediately go. Obviously, injury. If you're injured, you have a head injury, a broken bone, a burn or serious accident, you're bleeding and it's not stopping with pressure, all reasons to go to the emergency department. I mentioned the signs of a stroke earlier. Adding to that, a sudden facial droop, arm weakness, or slurred speech, a heart attack, crushing chest pain. But keep in mind that, especially in women, jaw pain can also, sudden jaw pain, sweating, shortness of breath, all these can also be signs of a heart attack. If you have a severe allergic reaction, whether you know what you're reacting to or not, it doesn't matter. If you have difficulty breathing, you have swelling of the face or your throat, you faint, or you have severe hives, then these are all reasons, again, to go to the emergency department. And then in children and the very young and the very old, I would add these: high fever, especially if it's not breaking with Tylenol, but you should be calling your pediatrician and be on the phone with them about that. If there's just lack of energy, that's what lethargy means, lack of energy. Breathing problems, seizures, they're not wetting their diapers, or they have severe dehydration. That's also a sign. Not wetting their diapers is a sign of dehydration. And very similar list in the elderly. So new onset lethargy or lack of energy, new confusion, not eating, difficult or rapid breathing, not urinating, and severe dehydration. All these are guidelines for when to go to the emergency department. And Preparing for a primary care visit, some of the same things apply here. So, bringing your medication list or your pill bottles, bringing your ID and an insurance card if you have it, but not necessary. Nobody's going to turn you away for not having an insurance card. It's illegal. Um, Note your medical history. So, as much of it as you can remember or have access to. Pack some essentials like a cell phone is important to take with you so that you can keep in touch with people. And then if you can, if at all possible, make sure you have support. Um, when you're not feeling well, when you're ill, you need somebody to advocate and be there for you. So if you do have the blessing of having somebody in your life who can go with you, don't be shy in asking them to accompany you. Um, and then preparing for an inpatient hospital stay. Um, you want to stay informed about your care, and this is all about surviving a hospital stay, really. You want to understand on a day-to-day basis what's happening with me today. So typically the doctors come in the morning, they round. If you're an inpatient, make sure if they can't stay with you and explain it to you, make sure that one of them comes back and explains what is happening with me today. What is the goal? What are the tests I'm getting? What are the new things that you're doing with me today in terms of treatment so that you understand what's supposed to be happening? Um, Keep a written record. Get a written list of all the tests, all the procedures and their results, all the medications, and all the follow-up treatments. Really important. Because when you're discharged, it's important to help your primary care physician or whoever you're following up with after the hospitalization reconstruct and understand what happened while you were there. I mentioned an advocate, so important. A squeaky wheel gets the most oil. That's true of a hospital stay. If you have somebody with you, things aren't happening at the rate that they're supposed to, which is why you're supposed to know. You need to know what's supposed to happen so you can make sure that it is happening. Have that advocate be the one who is talking to the nurses, talking to the doctors to make sure that things are staying on schedule and being very vocal about your needs. If you're in pain, be clear, I'm in pain. Um, this is, on a scale of 1 to 10, my pain is a 10 right now. I need you to let the doctor know that. So just be very vocal and very clear about your needs. And as part of the Black and Brown communities, always important to advocate for yourself. Ask the 3-question framework. What's my main problem? What do I need to do? Why is it important for me to do this? And if a procedure is happening, what are the risks of this procedure? What do I need to know? Why do I need the procedure? What are the benefits? Are there alternatives? And if you don't understand something, can you explain that in plain language? I didn't understand. Don't hesitate to ask these questions because clarity of communication, again, decreases medical errors and misunderstandings. I mentioned about being vocal about pain, being specific about pain, and then knowing your rights. You have the right to be treated with respect and dignity. You can ask to see your medical chart, ask to see any results, ask for explanations. Anytime you have a test, you should have the results of the test explained to you and why it's important. And if you are not satisfied with the way your care is going, you can always ask for a second opinion, or you can ask to speak with the patient advocate for the hospital or the ombudsman, um, whose job it is specifically to advocate for patients and their rights. And most
Hey, Dr.
hospitals,
Clarke, I wanted to point, someone asked a question while we're on this topic about how do you address asking for a second opinion without feeling uncomfortable about it?
yeah,
And I think this
that's,
goes back to your rights as a patient, but wanted to kind of address that while you were on the topic.
yeah. So, so look, healthcare providers have feelings too, which I think is what you're picking up on, or what your concern is. Like, will they be offended? But I think in the grand scheme of things, your health is more important than people's feelings, right? And so I think if you are um, you can address it directly with the provider, or you can ask specifically to speak to their supervisor, the chair of the department, if it's a resident, their attending physician, um, or you can have your advocate even find a second opinion outside that hospital, right? So that's sort of the order that I would say. Go to the next person up in the chain of hierarchy for that person, um, or find a specialist outside the hospital who you ask to consult on your case. The
But if
key,
you, if, I'm
the
sorry, go
yeah, I
ahead.
was just going to say that person though needs to have privileges at that hospital.
But if you're visiting, say, a specialist, if as a patient was referred to a specialist, and let's say that person may have been diagnosed with breast cancer, but didn't really either have a good experience with that particular physician or specialist, but they
Mhm.
could, on their own, in that situation or any situation, seek a second opinion without having to discuss that with that particular physician, correct?
Oh,
Right?
absolutely. I
Yeah,
was
they have
talking
the right
about
to do
the
that.
instance. I was speaking specifically about the instance of
The
being
hospital, yeah,
hospitalized.
right, in the
Right. But
hospital,
certainly,
yes.
if you're out in the community, you're not in a hospital setting, and you have you're you don't have a good interaction with a physician, you have every right to not even address that. You can just simply go and find a second opinion. Yeah. Um, I talked about the chain of command. I don't feel my concerns are being taken seriously. I'd like to speak to the charge nurse, or I'd like to speak to the attending physician, or I'd like to speak to the head of the department. Um, and again, the patient advocate can help to facilitate that. And then center your identity with confidence. Um, there's literature. I mean, they've studied it to show what we all sort of suspect, having probably been a patient at one point in time, being a patient while Black, right? Our symptoms are sometimes underestimated. So, I want to make sure my symptoms are fully documented. Please write in my chart exactly what I describe. Okay. And you don't have to say it in a confrontational way, but just say, I really want to make sure that this is as accurate as possible. So please, take down what I've said. And there's actually a law now that gives you a right to review the medical record to make sure that it's accurate. And then know when to escalate. If you feel ignored or unsafe or disrespected, um, you can call a family member. You can get the patient advocate. You can go up the chain of command. And there are also rapid response teams in some hospitals. Uh, if you feel um, in crisis, meaning physically unsafe. And then in general, this is more at a community level. If there are problems with a hospital or repeated issues with in a community, getting involved with advocacy organizations, faith leaders, to really talk about systemic problems that might be at a local level is always a good policy to advocate collectively. So I'll stop there. I know I've covered a lot. Happy to take any questions. We've talked about prevention. We've talked about it in all the various age groups. We've talked about vaccines in the various age groups. We've talked about what vaccines do. We've talked about communication and how essential that is in whatever setting it is, whether it's with your primary care physician, inside a hospital setting, going to the emergency room, and um, and then we've also talked about where to get care if you happen to not to have limited insurance or no insurance. So happy to take questions on any of those topics.
Thank you, Dr. Clarke. We have lots of questions in the Q&A box this time around. So lots of
Okay.
great information you shared today. So thank you for that. Before I get into the questions, though, I wanted to give a thank you to Latanya Richard for sharing her experience and that she's been able to put some of the things that she's learned and heard here in the series into action. And it resulted in a different experience for her with her healthcare provider and team. So thank you for all of that. And then we have a question that what is a reliable reading of a scan? For example, a transthoracic echocardiogram, I think is what they're trying to say here. Fair, good, and excellent. And when should you request another repeat scan as a result of the reading?
It really depends what you got the transthoracic echo for. Typically, that's looking at the structures of your heart and your aorta. So I don't know if it's because you had a leaky valve or, what the reason is. Um, but if you are continuing to have symptoms, or if you have risk factors like high blood pressure, then that test may need to be repeated, in the future. But that really is going to be dependent upon the reason you got the scan and a decision made in conjunction with your doctor. But don't be shy about asking your doctor, hey, do I need this again in the future and when?
Okay. And then after you get the virus, I'm not sure which virus they're referring to, isn't it just as effective for immune building and immunity as getting inoculated with the dead virus from I should say with a vaccine, especially for people who have working and strong immune systems to begin with. For example, this person had COVID twice and had never been vaccinated. Their sickness was very mild. And then the second time they got it, it was even more mild than the first time.
Yeah. So understand there are various reasons to get a COVID vaccine. One is to decrease your chances of getting it and also um, to decrease your risk of spreading it, right, to other people. The benefit, yes, it is true. When you've had COVID, you build up immunity to COVID, but COVID changes every year, which is why a booster is recommended. So even though you might have had COVID last year, the variant of COVID that's out this year, you may or may not have protection against. So that's why there's a booster every fall that contains the latest variants, and the same is true of the flu to protect you against getting COVID. When you get COVID, you're infectious. So, but when you get the vaccine, you're not infectious from getting the vaccine. So again, the benefits of getting vaccinated are it's not just protecting you, it's protecting you from getting COVID and also spreading it.
Okay. And someone wants to know now, building on that last question, with the new administration restricting COVID vaccines, what do you recommend on how to get it without having to pay for it?
Go to your healthcare provider and have them write a prescription for it.
Okay, that's simple and easy. And then, yes, we will send out the slides for someone who wanted to know. And someone wants to know that, well, is asking, they thought a DEXA screening for women of age 65. I'm not sure what the question is here, but
Yes, I did include that on the slide, so you'll have that as a reference when you see the slides. But yes, DEXA screening for women 65 and above is recommended.
great. And can you name some of the diagnostic screenings for heart conditions? This person just had a CTCA due to an angina episode and has a family history of abdominal aortic aneurysm.
Hmm. Yeah, so EKG is just it looks at the electrical pattern in your heart. It's not really if you're in the middle of having a heart attack, it helps, but it doesn't sort of say anything about your risk for heart attack. Um, a stress test is one where you get on a treadmill, or they can inject something in give you an IV solution that helps simulate your body working hard, right? Which is the same as being on a stress test. And that's to pick up if you are at risk for having a heart attack. And then finally, the CAT scan that you mentioned. is a way of doing a CAT scan of your coronary arteries to see if you have any blockages. And your cardiologist, your heart doctor, helps will determine based upon your level of risk, your family history, your symptoms, which of those is most appropriate for you.
Great. So obviously there was a lot of information that you shared today and great content on the slides. And someone wants to know if they have permission to share them. And if so, I mean, we can send them out as part of a follow-up for sure, but going further than that, the person wants to know if they do that, what is the proper source and citation and method that they should use to give you or whoever else is the source credit.
I'm fine with your using them. I'm I just want to get the information out there. So,
Okay, great.
um,
Um,
uh,
and it, oh, go ahead.
no, I was gonna, I saw a question about do you need an OBGYN if you're 65 and had a full hysterectomy? If they're the ones who are ordering your mammogram, yes. But if you have a primary care that can address that, then no, not necessarily.
Okay. And then someone wants to know, is it okay to do a at-home Cologuard test instead of getting a colonoscopy?
It depends on your risk factor. So your risk factors, if you have a family history of colon cancer, if you've had a colonoscopy in the past that found polyps, then no, you need another colonoscopy. But if you're otherwise healthy, you don't have any risk factors, then Cologuard is okay. But that's something that that's something your healthcare provider should be advising you on based on your risk factors.
Okay. So this person recently had a colonoscopy procedure and the surgeon didn't follow up with her directly, but after the procedure, an attending registered nurse gave her a folder and told her that they found nothing abnormal. Is this common practice? And then it looks like the same surgeon who performed this procedure 5 years ago spoke with me after because they found something, but this time I didn't see him at all. Is this the new norm now?
I I'm not sure I followed 100%.
So,
It
so I
sounds
think the
like,
first, this may be the second time she had a colonoscopy, and the first
uh-huh.
time the physician who performed the colonoscopy spoke with her after. But it sounds like the second time, which was most recently, the physician who performed it didn't. It was a registered nurse who communicated with her and gave her the results or the outcome.
Yeah. I wouldn't say that's a norm. Maybe that's a norm for that particular GI gastroenterologist doctor's practice. Maybe that's just their workflow to allow the doctor to do as many, sorry, spend as much time doing doing the procedure, and then if everything turns out normal, having the nurse communicate the results. That might just be their workflow. I wouldn't say that's the standard for all practices. No. And if that's
Yeah.
something that you don't like, I would mention that to the doctor.
Yeah, and this might be the case of getting a second opinion, but the question is, how do you handle it if you've had a basic screening and the provider thinks that you're okay, but you keep getting signs that there's an issue or something may be wrong?
Second opinion,
Yeah,
for sure.
okay, great. Can you elaborate on the second opinion question? You said you can just go and get a second opinion, but what does that mean when you're dealing with a health plan? Maybe like a HMO versus a PPO or something else.
Yeah. So I would, you're with a HMO, you're going to have to go back to your primary care physician and explain to them, look, I didn't feel comfortable with this doctor or with their, or I didn't feel comfortable with their assessment of what's going on. I would like a second opinion for whatever reason. I'm still having symptoms. I don't think they understood me correctly. They didn't spend enough time with me. Whatever the issue is, explain that to the primary care so that they can write you a referral for a second opinion. If
Okay,
you're in a PPO or an EPO, you don't need to do that. You can just access, you can just uh, find the person who you want to get the second opinion from and make the appointment and go.
great. And I'll respond to this. So there won't be a session on specific kidney problems, but if you do have some specific questions, please feel free to reach out to CBHN. You can email us at askcbhn.info, if you have specific questions or need any key information on kidney problems or issues that you're having. And then the last question in the Q&A box is, you may have addressed this, but do you need a pap smear after age 65?
Generally not. I would confer with your OBGYN or your healthcare provider. Again, if you're someone who is continuing sexual activity and you have more than one partner, then it might be the case that you do, but for the most part, no. 65 is generally when smears stop. Your
And
risk
then,
goes down.
okay, great. And I want to make sure that we got to all the questions while we're still here. Are there any questions in the chat that we may have missed, just in case? Either Ambria or Charity.
Not that I'm seeing.
Okay. Okay, great. So just to wrap up things here, I know we're a bit over, but did want to do a few more things to share with everybody. Just a reminder that if you attended these last 3 sessions, that's session 3, 4, and 5, you will enter a chance to win a $100 Visa gift card, and we'll do that drawing or name the winner on October 22nd or shortly thereafter. There's a few upcoming sessions or events that we're hosting. The next How Do I or Making the Healthcare System Work Better for You session is on October 22nd, and that is financing your healthcare. I think that's also an important thing to think about and know, especially considering there's a risk that some folks may not be able to stay on their current healthcare plan, or their premiums may increase. And so I think that'll be an important conversation to have with Dr. Clarke. And then we have a couple of member events coming up on September 30th in San Diego. We have an in-person member networking event. And then on November 12th, we have an in-person member networking event in Oakland. And I know Jamila is planning on some other networking events in Northern Virginia. I'm on the East Coast now, but in Northern California, not Northern Virginia, which no one on this call would probably be attending anyway. And so we want to know how we did today, what you thought about the session. So please take a brief moment, if you have your cell phones out, to scan the QR code and give us your input or opinion and thoughts about today and the session content. And then last is, if you're not currently following us or connected to us in any way, please connect with us on social media. It's at your CBHN, except for LinkedIn, it's California Black Health Network. You can support the work that we do through joining the campaign for Black Health Equity. And then thank you for being here today, for staying on a little extra longer to get some of the questions answered. So thank you again, Dr. Clarke, for sharing this important information with everyone. And we look forward to seeing you on October 22nd.
All right.
All right, take care. Have a
Thank
good
you.
afternoon. Thank you.